Well, good morning, folks. Welcome to another edition of Friday Morning Live. This is April 2nd, 2021. It's a good Friday. So hope you're having a good day so far, and looks like a beautiful weekend for most of the state of Florida, especially up here in Tallahassee. So today's topic is with our friends Frank and Susan from Oceanus Partners. Just prior to coming online today, Susan informed me that they're sunsetting the Oceanus Partners name and going to Growth Solutions, still a Resource Pro company, but didn't get the memo in time to update the slide, so we'll make sure we make that change and get everything updated. But certainly the same expertise, the same resource that we've known and loved for the last several years, having this partnership with Frank and Susan. So we'll continue down that path. And there's yours truly, Dave Newell. Hope everybody's doing well again today, and look forward to a great Friday morning live with our friends, Frank and Susan. And there they are. So welcome, guys. I know you both are in Pinellas County, enjoying the beautiful sights there, and look forward to having this discussion this morning. A few housekeeping things just want to point out as we continue to evolve through this pandemic. Web-based learning is still the way we're presenting content here at FAIA. We've not put any live classes, in-person classes, on the road yet. We're doing virtual classes through our website. We're doing many virtual classes for agencies for what we call virtual on-sites for content that they would like to share with the whole staff. So if you have any of those needs, please let us know, and we'll certainly line you something up from a virtual basis. So beginning Monday, April 5th, many of you know, the governor's emergency order is still in place for 440s to work remotely. One of the things we're beginning on Monday, April 5th, is offering another academy, the 2044 Academy, for those agents that would like to convert their license from a 440 to a all lines, personal lines license, the 2044. That license will allow agents to work remotely or in the office, regardless of an emergency order by the governor or the CFO. So we'll kick that off on Monday, and it's a 4-week program where we lead you through the virtual classes. There's 17 of them. Each week there's virtual office hours with the instructors to ask questions. And the other thing that comes with the academy is the ability to be part of a community. So all those that are taking those classes throughout those 4 weeks will be put into our 2044 Academy online, and you can converse with each other throughout your time going through the academy. And that has become a pretty good tool to kind of put some questions and some sounding advice in there. I try to put something in there daily, kind of just, prod people a little bit. I'll post some questions. I'll pose some comments. And so just kind of create some dialogue in that community. So that's what the academy is. We look forward to having another class. And like I say, it lasts about 4 weeks with weekly live Q&A with the instructors. So if you get stumped on something, you can either throw it in the community, send us an email, or wait. We do them every Thursday for about an hour and answer questions. So again, if you have any questions, certainly reach out to us here at FAI. We'd love to talk to you about that academy. So Frank, Susan, again, welcome to Friday Morning Live. And Frank knows this has been a question that's come to us pretty routinely over the last couple years. I was telling a story this morning, Frank, to our friend Mike, our IT guru that just walked in the office. When we first submitted you doing a class like this for us several years ago, the class originally was denied by the department for CE purposes. And when we had the conversation and tried to explain to him how important this subject matter was for agents in Florida, even though at that time medical marijuana had not been, part of the law, approved for law here. As we explained it, Florida agents do business in states outside of Florida, and those states may have the ability to have medical legal marijuana. So the class was approved, and then we've been talking about it ever since. But this is certainly a topic, and we'll delve into it. And I really implore each of you that are on today to ask questions. There's things that you're experiencing from your clients internally within your agency that you guys are having a bit of discussion about this topic. Certainly pose them. We'll get to as many as we can, like we do on Friday Morning Live, and anything we can't get to, we'll get Frank and Susan to answer them offline. So, but Frank, kind of talk to us a little bit about this concept that we're talking about, medical marijuana, and certainly the Florida drug-free workplace, where many businesses in Florida have this credit applied to their workers' compensation policy.
Yes, Dave, thank you. And thank the participants for joining us here this morning. Appreciate the opportunity. As Dave mentioned, we get a steady flow of questions that go along this line. I have an employee or I have a client with an employee that has a medical marijuana card. How does that affect their drug-free workplace? Can I hire them? What happens if they get injured? Well, the legislature was very clear about this. And Dave, on that next slide, it actually talks about that very clearly, and this is something you want to keep this language handy, that it does not limit the ability of the employer to establish, continue, and enforce a drug-free workplace policy, which means that they don't have to accommodate medical use of marijuana in the workplace or any employee under the influence. So in essence, the medical marijuana approval in Florida does not override or preclude the rules around drug-free workplace, which essentially say this: if you test positive at time of hire, we can choose not to hire you. If you test positive at time of injury, there's a possibility the claim could be denied. So medical marijuana card or not, nothing has changed with respect to Florida drug-free workplace. And let's also just keep this in mind as well. It's still against federal law. So irrespective, and I know that's an issue I'd like to see the country work out, get some reconciliation there, because we just saw yesterday New York went full-blown recreational, and more states have. So it's still against federal law. We have some OSHA implications with respect to that, but by and large, medical marijuana approval, having a card, does nothing to change any responsibilities or opportunities for the employer with respect to drug-free workplace.
So, again, folks, if you have questions on this, start lining them up in your question pane there on your screen. But so, Frank, on this, as you highlighted, this is the summary of what we've been talking about for probably the last few years. And right. now you throw in what you just said about New York and other states that have decided that, they're going to allow it, in other forms and fashions. So, right. I guess this is just an evolving issue that more and more information and more differing views will have to be, talked about as we try to figure out how best to, deal with it from a work comp standpoint. Correct?
Correct. And it's a complex topic. I occasionally get an email from agents that say, somebody's got a medical marijuana card. What should the employer do? Well, it's fairly complex. It's not a simple question. But one thing is very clear. What you could tell your clients is you have a drug-free workplace. The medical marijuana card has zero influence on the rules and the law surrounding drug-free workplace. Employees can be not hired, and claims can still be denied if they test positive for marijuana, even with a medical marijuana card in Florida and under the Florida Drug-Free Workplace Program.
Yeah. Frank, and again, we'll see if this has entered your domain. One of the questions that just came in was, are there any EPLI lawsuits being made from employers not hiring and or letting go of someone who tests positive at the time of injury?
Not yet, but I wouldn't be surprised. I think that employment practices liability insurance is something that due to this issue, as well as the reentry under COVID, we're seeing a lot of increased activity there. To date, there's not been any suits that I'm aware of, and I think the legislature made it very clear that in the event of a suit, you're going to have some defense costs, but they made it very clear in the law. Could a judge change that? Do judges ever have court cases where judges change the intent of the legislature? Of course. But the legislature's intent is extremely clear. Now, anybody can sue anybody, and I wouldn't be surprised if there's employment practices lawsuits arising out of this. But as it stands right now, and of course, Susan and I always say we're not attorneys, and we don't play attorneys. And it's always good to get a legal opinion on this. But from reading what the intent of the legislature was under this law and the law itself, that the employers will be in good stead to honor their conditions or to follow the conditions of their drug-free workplace. And who knows who may want to try to litigate as a result of that. Right.
So a couple more questions, Frank, while we're on this subject before we switch gears to
Sure.
Another favorite topic around here is executive officers and premium audits. But, can an employer tell the work comp carrier to pay a claim if that particular employee was injured and had a medical marijuana card? What have you had any discussions surrounding that topic?
That is entirely a carrier decision. The employer has zero influence over whether that claim will be paid or not. Now, carriers, from my experience, have been hesitant to deny those claims.
Right.
They've just been hesitant for reasons of their own, but it is their sole decision, their sole discretion as to whether they're going to pay that claim. I've had conversations with heads of claims departments. They give me a whole host of reasons as to why they choose to go ahead and pay the claim. We don't want to create bad case law. It's easier just, especially if it's a smaller claim. Now, if it's $1 million claim, that's going to be a different matter, folks. I hate to tell you this, but $1,000 claim and $1 million claim have different levels of scrutiny at the carrier level. But it's solely the carrier responsibility if there's a drug-free workplace. Now, there's a choice not to have a Florida drug-free workplace program. That brings up another whole set of issues.
Yeah. And then the next question is from our friend Jeff. The employer can decide and elect to hire that employee with a a medical marijuana card. Is that correct? I mean, they can.
They can. Well, if they have a Florida drug-free workplace program and they're getting the 5% credit and they're meeting all the criteria, they're not. If they test positive at time of hire, because we have to test all new hires. My understanding is they can't. There may be some wiggle room where they can hire them and refer them to an employee assistance program and retest them down the road. That's something I'd really want an attorney to weigh in on, Dave. But a lot of employers are just doing away with the drug-free workplace program as a result of these complications. Now, without the intent of the drug-free workplace program, the Florida drug-free workplace law, was to take the issue of causation off the table.
Right.
There's always been, if you're under the influence, a claim could be denied, but the carrier had to prove whether or not that under the influence status caused the injury. drug-free workplace was intended, the law was intended that if you tested positive, we're going to presume that it was influential in your injury, and we're going to deny. So be very careful around these issues. These are complex issues. We certainly support getting an attorney sign off on these types of issues when it comes to hiring, whether it comes to maybe rescinding your drug-free workplace program, and those types of issues, because it's complicated. It's not simple, and it's going to become more so. What happens if the legislature now then makes it recreational, like many other states?
Right.
Then we have another whole kettle of fish to deal with.
Yep. All right, folks. We're going to go ahead and switch gears, but if you certainly have anything else on the medical marijuana and the card and the drug-free workplace, certainly pass them along, and we'll get to them further down this presentation. But Frank, switching gears on another topic that we certainly have gotten a lot of questions. You've done a lot of offline conversations, not through the community or through emails, but have had direct correspondence via telephone and many calls related to this exempt corporate officers in construction and premium audits that seem to have gone a little awry, as they say, by some auditors. And so kind of set up what the background is of what we've been seeing and what you've been seeing surrounding these two concepts.
Sure, and we've got one going right now, Dave, with a FAIA member that's quite substantive, and it's in play. So here's what's going on. Exempt corporate officers in construction. The law allows up to 3 corporate officers to exempt themselves if they own a construction company. You have to have at least 10% ownership, and they exempt from workers' compensation. The rules are very clear. No premium can be charged when they're hired by another contractor. So a contractor, your client, hires one of these exempt corporate officers, says come in and do the tile work in this $1 million home, or come in and do the hang these cabinets in this corporate office or in a home. And what the carriers are doing, and look, let me first say this. I have empathy for carriers with respect to, none of us want fraud. None of us. We're all opposed to fraud. We can all stipulate we're opposed to fraud. But also, I can have 2 thoughts in my head at the same time. Right. I'm opposed to fraud. I don't want fraud. It hurts everybody, especially the clients that are doing it right. But I also am opposed to carriers making up their own rules. And what a number of them are doing is they're drawing an arbitrary line in the sand. And they say if an exempt corporate officer does work that exceeds, I know one carrier is at $50,000. The one I'm working on right now with an FAIA member is at $75,000 in contract revenues. They're going to charge the excess of that as if it's payroll. They cannot do that. Dave, if you go to the next slide, please. Yep, this is totally against the rules. They're not allowed to do this. They're charging for this arbitrary amount over and above sales. They're essentially saying, well, there's no way this person could do that much revenue by themselves or just with another corporate officer or 2. They'd have to be hiring other people, paying them cash and the like. So, but it's against the rules. And if we go to the next slide, they'll just emphatically say they're doing it, but no, it's not allowed. It's not allowed under the rules. And it's not an option. The workers' compensation policy says we will follow rates, manuals, and rules, which ties the NCCI basic manual right to the policy. It's like stapling the NCCI basic manual right to the policy. Well, with the help of FAIA, Laura Pierce and Dave and likely others that worked on this, back in December, as you can see, of 2019, we were able to negotiate with the department and with NCCI to put out this circular. I just screenshotted the top of the circular. It's NCCI calls it an FYI circular. It's a reminder to the carriers of the rules. And in this circular, it says you can't do that. You can't do that. And they said, if you want to do that, well, here's the steps you need to take to change the rules. So we have carriers that are blatantly violating the rules around premium audits under the auspices of, we believe fraud is occurring, therefore we're going to address it by just doing our own thing. We've had $30,000 audits that have been rescinded. By the way, when an FAIA member reaches out and we walk people through this and share this circular and so on and so forth, to date, we are undefeated in having the carrier rescind their position. But they're still doing it.
Right.
They're just waiting for people to hold their feet to the fire.
Yeah, I think that's the key to that. Frank, we've had a lot of success, but we're still not seeing a change in how they're processing these and how they're viewing these. Many are. So advice today, folks, if you find yourself in this situation, you find yourself with one of your clients that, is kind of alarmed about seeing some of this additional premium, reach out to us. Frank has been heavily engaged. Laura Pierce, heavily engaged in this conversation. So anything we can do to help you and your client, ultimately, we're here to do that. So a question that came in, Frank, when you talked about it on the onset of this conversation, so what kind of, we're all against fraud. So what kind of fraud potentially is out there that could drive some of this that the carrier's concerned about?
Yes, well, let's assume I am a tile layer and I'm a one-man band, and that particular day, or I've got a partner that's also an exempted corporate officer. Well, my partner is sick that day, so I drive through the Home Depot parking lot, and there's generally people hanging out there looking for construction work, and I say, hey, you want to do some work today? I'll pay you X number of dollars in cash to help me, at the very least, haul the tile up to the second floor in those heavy boxes and be my assistant. So they pay the person cash out of pocket. And if that person gets hurt, that's an uninsured subcontractor. They're not exempted. The carrier is going to be on the hook for the claim. Premium will not be paid. So this is going on. I mean, I have empathy and understanding, but I'm also a rules guy. You don't like what's going on? Change the rules. You're not allowed to. I've got an email from one of your members, Dave, that and I've got to keep this all confidential right now. But the carriers are actually admitting what they're doing in emails. They're admitting it, and they're confessing to what they're doing, and they're feeling pretty well self-righteous about it. So this is a big issue. I'd like to see it get fixed with perhaps there's a whole process to change the rules. It's an issue. It should be addressed, but it needs to be addressed the right way.
Right. So, again, folks, if you have an issue, you have a concern, please reach out. We'll get you in touch with Frank. Certainly, he can provide a lot of ammo, as we say around here, to create an argument with that particular carrier. And certainly Frank has been very helpful because he has a lot of carrier relations with many of the work comp carriers here in Florida. So certainly encourage you on this topic and others, anything related to workers' comp. But this is one, as you said, Frank, we continue to get questions. We continue to get correspondence on this, of what carriers are doing out there in the marketplace from an audit standpoint. So, again, thanks for the update on that. And
pleasure.
And because we've been in a holding pattern for the last year or more now, COVID-19 continues to drive a lot of conversations. Just prior to coming on live today, Susan and I were having a conversation about our annual convention in June, and we'll talk about that in a minute. But there's also just, what companies are doing, travel restrictions, so on and so forth. So from a work comp standpoint, Frank, I guess let's just talk about what you're seeing and what you're hearing in the marketplace from a COVID-19 perspective for workers' comp.
Yes, and the state has done a phenomenal job of sending out these monthly reports and keeping us up to date. Florida has not approved, like other states, a handful of other states, a presumption law. Presumption meaning that if someone says, hey, I've got COVID-19, I'm sick, and I got it at work, in some states, the state's taking a position, you are presumed to have contracted a disease in the course and scope of employment, and work comp will pay. Well, Florida's not gone down that path. But when you look at the next slide, this is fascinating to me. Carriers are paying claims. You can see up through the end of February, over 37, almost 38,000 indemnity claims have been paid. And here's what's happening. The carriers are paying claims on first responders, nursing home people, healthcare people. If you're in healthcare or you're a first responder and you file a claim, the carriers are paying those claims, and they're doing it around the auspices of the law. Basically says this: look, if the disease is in the general public and you would get it in the general public, or the terminology they actually use is it specific to the workplace? Well, first responders, nursing home workers, hospital workers, doctors, it's pretty specific to the workplace there. And it's just, I think the carriers, it would be a PR nightmare not to pay COVID claims. And they're not that costly, by the way. With very, very few exceptions, they're not costly. So they're paying them for healthcare workers and first responders. And you can see that it's still ticking up a little bit. Looks like it's trying to flatten out. Hopefully the vaccines that I think become available to just about everybody over 16 next week, at least over 30, are gonna, bend that curve and get us on our way. But we're paying claims in Florida, and advice always, and I get this from David Thompson as well. We talked about this on the business income issues way back a year ago. If someone says, I want to file a work comp claim because I've got COVID, and file the claim, let the carriers decide whether it's compensable or not. But even without a presumption law, we're paying claims here in Florida.
Yeah, that's a great point, Frank, because, we monitor this, and as you see on your screen, folks, I mean, the numbers continue to increase a little bit each month. July was certainly up quite a bit, but this is happening in the marketplace, and people, like Frank said, let them file the claim and let the carrier take over from there. So any questions on those, certainly pose them, and we'll get them answered by our friend Frank. So we mentioned convention, FAI's 2021 convention, Waves of Change. Registration is open, and our friend Frank will be a presenter, a breakout session there. And Frank, again, this is a topic that I think we'll not only continue to talk about in June, but even beyond that, of what the effects of COVID-19 have had on the workers' comp system and the marketplace in general. So kind of just give us an overview of your thoughts of what you're thinking about post-pandemic world when you present in June.
Yeah, Dave, this is it's going to be interesting because some things are not going to go back to the way they were, or we're going to have new and different ways or escalating ways of dealing with injured employees in the workplace. For example, telehealth apparently has exploded and is likely going to continue. Even telephysical therapy. So it's the teledoc. People are pretty comfortable with that. I know with my own personal private physician, I've done a couple of virtual meetings with him, and I love it. I don't have to go to his office. I have to sit there. So that's going to be a part of work comp moving forward. The states are dealing with the regulations. That's been some of the challenges with respect to that, and also the fee schedules. As I mentioned, telephysical therapy is also becoming a thing. We're going to have a lot more remote workers, as we've talked about. We'll take that on. And the issue that is probably the 800-pound gorilla that nobody's really figured out how to deal with yet is we've got an extraordinary mental health crisis arising out of this pandemic, and we don't have the resources to address it. So we're going to talk about some of that as well, and just what are the risks that are going to continue to emerge in this post-pandemic world, specifically to workers' compensation, specific to employees and their workplace, and what we need to do as agents and brokers to better prepare clients for what's around the corner, up over the bend, and help them to prepare, because some things are just not going to go back to the way they were.
Yeah, that interesting point, and certainly the other aspect of this, and certainly agents on the call and will be concerned about this as well, is certainly the privacy aspect, the data
Right.
information that now is being kind of, let's be honest, it's being displayed over the airways when normally it's displayed within a doctor's office behind closed doors. So
That's right.
We were at lunch yesterday, and Kevin, our friend in the E&O department, was talking about CNA had just gotten hacked with a big cyber attack. So, it's happening, big or small, doesn't matter. Mom and pop shop, fix it shop, cyber crimes are happening all over. And so this is another avenue that potentially they can, get their fingers into and start securing personal data because of this interchange from a telemedicine conference call,
Absolutely.
So, all right. Well, thank you so much, Frank. Certainly you're going to stay on board, but we're going to switch gears a little bit and bring in our friend Susan and talk about, the impact of COVID in the sales culture. Again, before we went live, Susan and I were talking about hearing from many of our members that have decided to, non-renew leases, to sell their brick and mortar space, to go to a virtual office, to rent maybe space in one of those, common buildings that have individual offices in them. So I think the impact that we're going to see from the sales process, the culture that's been created out of COVID, and then Susan outlined some tips and some things that we need to be thinking about post-COVID. Right, Susan?
Yeah, absolutely, Dave. And thanks for having me join today's conversation, and welcome everyone. This has been a really interesting year for sellers and and for producers. As Frank and I kind of sit back and look at the folks that we engage with, our members in the community as well as across the country, we see sort of a big spectrum, a wide spectrum of response to selling in this environment. There are those that have felt really didn't skip a beat and were very comfortable making that transition to remote selling. And there were others that really struggled with it. And I think if there was a defining factor of what made folks feel comfortable was their approach pre-COVID. Were they really focusing in on business challenges and business risks? COVID provided what we refer to as a trigger event to reach out, to help discuss how the business was going to respond to it, to share insights and information around their new responsibilities. For those that focused more on developing relationships and really relied more on relationship selling and being able to be seen, there was a bigger challenge.
Hello?
Yes.
Oh, I thought I lost you.
No, not at all.
Okay.
So I saw really a different response between those sellers that focused their messaging pre-COVID around risks, business risks. They were able to continue to develop their relationships. They felt comfortable using COVID, as well as some of the other trigger events that have happened. We had recently the situation in Houston, huge trigger event around how insurance could respond and help businesses and help individuals make decisions around preventing losses. We see lately, just in the news the last couple of days, some of the societal issues that are changing. you look at what CEOs are focusing in on today, they're looking at environmental risks, they're looking at these social issues and governance. There was a recent study out by KPMG that talked about some of the top issues that CEOs are facing. And those producers that really focused in on risks and business challenges CEOs were facing, as I mentioned, didn't skip a beat. They had new content to talk about. They were able to pivot. They were able to stay connected to their prospects far more effectively than those producers that really relied on engaging with their prospects from a relationship selling standpoint. So it was really interesting to observe. Frank, I don't know if you have any thoughts on that.
Well, Susan, you and I had an opportunity, as you have said here, to work with agents that had their best year last year.
Absolutely.
And one of the main reasons was the incumbent agents that were commodity-based agents that were bid and quote, I got great markets. They were panicked when the pandemic hit because they didn't really have solutions to the complexity that was emerging. I mean, new laws were coming out, the Family First Coronavirus Act. What does all that mean? And on and on and on. There was new information. The commodity-based agents, many of them went and hid, and the agents that were ready to engage, be consultative, help people solve problems, especially problems that they have never faced before, they reached out. People were locked down. They were able to get a hold of people and have conversations about these new and emerging risks and what to do with them. And we know many agents that had their best year ever because many of the incumbent agents were not prepared to be consultative and helpful. They were product pushers on a commodity basis.
Absolutely.
Right.
And it really exposed that need for the evaluation of how are we trying to connect with our prospects and clients. And I think that this is something that's going to lead into 2022. I think this is really going to have a significant change, you know, based on the conversation we were having prior to this with Dave around how many companies, businesses are going to be continuing that work from home environment. They're going to be moving out of their big office buildings. Being able to just drop in on someone is going to be a challenge, which means that we have to find new ways, producers have to find new ways to be able to connect with their prospect, in many cases also with their clients, in order to continue to build that rapport. So we have to be comfortable inviting folks to virtual events. We have to be comfortable sharing meaningful content that's going to pique their curiosity and elicit a response and ask them for, lead them to ask for more, lead them to want to engage in a conversation. And as you mentioned, those folks that were commodity sellers, they are, I think a lot of them hunkered down and figured, you know what, it's just going to be a tough year, but next year is going to be different and I'm going to be able to get back out on the street and see people. I'm not so sure that that's going to be the case.
You know, I mean, that's a great point. And you don't know if that's really the direction that many of the agencies and brokers want their producers to be in, back on the street totally. Because this environment has changed, and being in this virtual environment, like you say, setting up, you know, I talk to many agents, you know, setting up these Zoom calls, you know, every hour with clients and not getting in a car, not, you know, meeting in a certain restaurant or a certain locale, has made them more productive and more efficient. And as you said, many have had the best years through this pandemic. So it's just a great point of how this will be a continuation of what COVID has made us into, and I think in the future will certainly enhance that sales process.
Dave, my sister's a big shot with a company people would know here in Florida, and she told me that they're making decisions system-wide, that there are just certain types of meetings they will never have face-to-face again, period.
Yep.
That it was unnecessary to meet with people face-to-face, and there's just a whole host of those face-to-face meetings that are just going to evaporate and never happen again.
And, you know, Frank, I think what's really the big takeaway from that, the big opportunity in that is CEOs, CFOs, the people we typically reach out to meet with, to have conversations with, are so guarded with their time anyway, that the idea of setting aside 30 minutes, 40 minutes for a face-to-face meeting, there was a lot of resistance and pushback to do that pre-COVID. Because they were afraid they weren't going to get value. They were afraid that the person wasn't going to be prepared for some insightful conversations. Far easier to secure a 5 or 10 minute phone call than a 30 or 40 minute investment of a face-to-face meeting. So I think if producers can begin to pivot their expectations and begin to think about, you know what, if I'm going to reach out to somebody, what are the 2 or 3 things that I think are going to be top of mind? What are the business challenges that they're facing that I can speak to? What kind of research can I do to demonstrate that I understand what initiatives they may be taking on as an organization, what challenges they may be seeking to overcome, and get a tight message and say, can we spend 10 minutes on the phone or on a quick Zoom call to talk about what we might want to share with you, and to see if it's going to be of value to you, and if so, we can explore taking next steps from there. I think we have to pivot our expectations around shorter meetings, telephonic or leveraging technology through Zoom.
Yeah.
And Susan, if I could add one thing to that, apologize, Dave, for interrupting. The other thing to add to what Susan just said that I believe is critically important is, folks, please understand that what Dave mentioned about the efficiency, what Susan mentioned as well, it's still not the same as a face-to-face meeting. You don't have your entire body language to communicate. You have to be better. You have to deliver far more powerful messaging. You're going to have to use visuals. It's not the same. It is not the same as being there. Now, there's a lot of advantages that have just been outlined by both Dave and Susan, but you need to elevate your skill set, because you cannot do through Zoom what you can do face-to-face with respect to communicating non-verbally.
Yeah.
Or it's going to take a lot of practice. It takes a lot of practice to get comfortable to drive an agenda-driven meeting through Zoom, like you may be comfortable to do face-to-face. It's a little bit different. You've got to have a very expressive. You have to be really careful of your tone, Frank, as you often say. But it's hard to get that body language in there. Or to read body language. The folks I feel I have probably the greatest amount of empathy for are the folks that are just entering into this industry over the last 12 months. But I also believe they have the greatest opportunity to not build bad habits.
Yeah.
If they can really focus in on doing good research prior to reaching out, if they can subscribe to newsletters from folks at KPMG or PwC or McKinsey and Company, and really hone in on what the business challenges CEOs and CFOs are facing, and demonstrate some empathy when they're reaching out and saying, I've been doing some research, here's some challenges that I'm seeing happening, here's some legislative issues that may be top of mind to you. I'd like to set up a 5 or 10 or 15-minute phone call with you to discuss this. I think they will position themselves as a subject matter expert and someone who's a source of business value. And instead of focusing on getting to know people and really elongating the sales process, I think there's a tremendous opportunity to demonstrate your capabilities sooner in this type of environment if you do the research, if you practice and become comfortable leading remote conversations.
Yeah, I mean, that's a great point. And as we switch gears and talk about, as you talked about people entering our business in the last 12, actually 24 months, newer producers, newer folks in our industry, that sales and prospecting process has now changed due to COVID. So, there's some points that you address here, Susan, that will help those in attendance on today's call to arm them with some better information that they can, take and put into practice right away, right?
Absolutely. You know, we talk about the trigger event of COVID and the impact that that has on businesses. We've talked about other trigger events, whether they're weather related, which you and Frank were talking about earlier with this audit issue. Those are all trigger events. Those are all reasons to reach out to a prospect and say, we've been seeing some trends in the industry. Want to see if this is something that perhaps your business is at risk for. That could be a risk to your business. Would you like to have a conversation around that? The other thing that we're seeing that has to change really, and is an easy change in this particular environment, is the frequency in which producers reach out to their prospects. You know, one of the challenges, I think, working from home and working remotely is we get in our head a little bit too much, and we think, you know, man, if I reach out more than once a month or once a week to a prospect, I am going to be perceived as this pest. And that's not really the case. Research shows, and we've done a lot of research around messaging cadences over the last 18 months. And what it's shown is that we have to, the research shows that you have to reach out with what I call persistency and consistency in a relatively short period of time. So in a 4 to 6 week period, it's suggested that you touch your prospect 8 to 12 times. That means a phone call. That means if you don't reach them through the phone call, that you leave a voicemail. That means after your voicemail, you follow up with an email, with an article or a white paper or a link or an invitation to attend a webinar. That means that you reach out to them in social media and you continue that process, that consistency of touch and around a purposeful topic. That's the key. It's got to be a purposeful topic. It's not about, can I come in and take a look at your insurance program? It's got to be focused in on a business risk or a risk or a challenge that that person is facing based on their seat in the organization. That persistency drives more first appointments. And I think a lot of folks are hesitant to do that, or it's become a little bit more challenging because maybe the agency doesn't have the technology that allows the producer to do that efficiently. And so producers are kind of struggling to, okay, I buy into the concept, but how do I do that and juggle all of my other responsibilities as well? And so prospecting has changed. There is an expectation that you will continue to reach out, and those reach outs obviously in many cases can't include drop-ins the way they did in the past. So we got to go back to direct mail. We got to go back to maybe recording a short 1 or 2 minute video. We've got to go back to procuring what we call high value content, articles that are going to be relevant to the prospect that you're reaching out to. And we have to continue to reach out in a short cadence over 4 to 6 weeks with multiple touches.
Yeah, that's a great point, because, you know, as those on the call, the agents, you know, that process sometimes is a long period of time as you're trying to, you know, uncover the risks and the weak spots of that program. But like you say, through this COVID environment, we've got to shorten that timeline and be able to create additional value each time we touch them. So great point.
And there's so much going on, Dave, that producers can take advantage of. There's so much in the news. There's so many legislative changes. There's so many societal things that are happening, which are really top of mind. I was doing some research recently for an article that I was writing around what CEOs are thinking sort of in this period of time we are with the pandemic, and how much there's been a shift in their thinking since the beginning of COVID to now. So staying on top of what's going on with our buyers, that allows us to have fresh new conversations. And so it's going to require us to do some more research. It's going to require us to be a little bit more inventive, but we're seeing more folks use videos to connect with people, video testimonials. Now's a great time to reach out to your existing clients and say, can we spend a little bit of time recording your thoughts around what we do and the impact we've had and how it's had a benefit to your business. Now's the time to interview our existing clients and create case studies that we can share out in the marketplace and reinvent how we're engaging and how we're sharing information with our prospects.
Yeah, great points, great advice, and certainly, folks, if you have any questions, go ahead and put them in the question pane. We'll get Susan and or Frank to respond to them. And I know this continues to be an evolving conversation. As COVID continues and we come out of the pandemic, and certainly look and see and feel how this may evolve. So a lot more to come on this topic, and certainly we're a resource here. Frank and Susan are a resource as well. Have really coached a lot of people. They're the good thing about Frank and Susan too. They're based in Florida, but they have clients all over the country, so they're seeing and hearing a lot of varying points of view and a lot of varying communications amongst their clientele. So they really bring a wealth of knowledge to this topic, to these concepts. So certainly, if you have any questions, reach out and we can put you in touch with them. And if you have anything specific you want to work with them on, we'd be more than happy to put you in touch with them. So no questions are coming in at this time. So we'll see. We'll just keep plugging along. But again, Frank, Susan, it's always a pleasure to have you guys involved in anything at FAIA. You've been a partner of ours for many years now. You're friends, and certainly you have helped many of our members through the struggles of workers' comp from these issues that we brought up today. But certainly, Frank, we can't have a conversation without talking about our friends at the JUA. So we certainly will keep. So if you're struggling with some of that as well, Frank is well versed, unfortunately, in some of those issues. But it's funny. I was just talking to an agent was complaining about the JUA in another state, the state of Missouri. Our friend,
we're not alone.
Steve Coonrod is engaged in an issue that is in Florida, but the entity is based in Missouri. So interesting. But yeah, so all things workers' comp we can help you with, our friends Susan and Frank. So certainly let us know if we would do anything for you. And again, guys, thanks for being on today. Always a pleasure. Upcoming shows, April 16th, folks, Amy Davis of Trusted Choice. Many of you are part of the trustedchoice.com network, and Amy's going to be on talking about how to continue to leverage that relationship that we all share with Trusted Choice and answer your questions. So certainly recommend you registering for that particular session. May 7th, many of you on this call use Ivans for a solution connecting agents and insurers. So our friends from Ivans will be on talking about how they can leverage that solution and maximize that relationship that you currently have. And then we'll round out May 14th with our friend B.G. Murphy and Laura Pierce. We're in the throes of the legislative session. There's a lot going on right now, folks. So certainly pay attention to BG's weekly updates, his blog, and certainly his spreadsheet updating where the bills are, and so a lot of comments surrounding that. We're struggling with the property market here in Florida, and BG and Laura. We threw Kyle into the mix this week as well. Sent him downtown for a few meetings, including yesterday. So they're in the throes of this. And as we continue down this path, we're going to be reaching out. And if if you have the opportunity, and once we reach out and to help us shape that conversation, shape that legislation, certainly pitch in, because we're going to need all the help we can get the final 4 weeks of the legislative session. So, but that rounds us out on what we're expecting over the next month or so with Friday Morning Live. And again, a reminder, folks, at this point, April the 2nd, 2021, registration is open for our annual convention. It's at the Rosen Shingle Creek. We look forward to having an in-person meeting, and we're going to take all the precautions, all the guidelines, all the safety protocols that we can put in place to have a safe in-person meeting. So take a look at the registration page, take a look at the hotel availability, and certainly the breakout sessions. We've got a lot planned this year. So we appreciate your time this morning on Friday Morning Live. Always a pleasure to be with you for about an hour every other Friday. So have a great day. Again, happy Easter. Enjoy the weekend, and enjoy some baseball, because baseball started yesterday.
All is right with the world.
Exactly.
All is right with the world.
Exactly. Well, I mean,
Dave, the Rays are on track to win 162 games this year. They're on track.
that is impressive.
They won yesterday, so
yeah, exactly. So again, folks, thank you so much. Appreciate the time this morning, and reach out if you have any questions or issues, and we'll certainly get them to Frank and Susan to help you along the way in this conversation. So again, Dave Newell, and take care, guys, and have a
Thanks,
great
Dave.
weekend.
Thanks, everyone.
Okay.